Hello, my name is Jasmine and my presentation is about treating a patient with a sprained ankle, but first let's discuss some preventative measures to prevent a sprained ankle in the first place. So warm-ups before activities is super important, stretching and strengthening the ankle muscles and the leg muscles, and wearing supportive footwear. Warming up, stretches, and strengthening the ankle is super important for blood flow and increases flexibility. Supportive shoes provides an even and stable base for the feet to land on and preventing the ankle from rolling. Overall, these preventative measures will increase the range of motion and overall increase the quality of life. Hi, my name is Jasmine. I'll be your CNA today. Could I just get your first and last name and date of birth, please?
Jaden Sinclair, and then my date of birth is 10/08/2007.
Okay, sounds good. So the doctor informed me you came in with some intense ankle pain, is that correct?
Yes, I rolled my ankle this morning and it has been non-stop pain.
Oh, okay, I'm sorry, that's not good. Could you explain to me what you were doing that caused your ankle to roll?
I was doing my morning exercises like I do every morning, and I was speed walking laps in my house since it got cold outside, and I was just turning the corner to go into my hallway from my kitchen, and my ankle just gave out of nowhere.
Oh, okay, that sounds pretty painful. Any chance you did some warm-ups before, or do you usually stretch before you work out?
No, not really. Sometimes I will stretch just because it feels good, but other than that, no, I don't do any warm-ups or stretches.
Okay, sounds good. Did you happen to be wearing tennis shoes or running shoes?
No, I don't own a pair of tennis shoes, so I just wear my Crocs or even my slippers because they're comfy.
Okay, well, I'm sorry you don't have a pair at home, but you should definitely start wearing shoes or tennis shoes when you're doing any kind of exercise. I could possibly see if the hospital has any donated shoes for you. If you'd like, otherwise, would you be able to or be willing to provide some for yourself?
I suppose I can get my own. My old pair still might be at home, but I'll see.
Okay, sounds good. If anything, we can take care of that. Could you tell me what the pain is feeling like from 1 to 10, 10 being super bad and 1 you barely can feel the pain?
It's about an 8 right now.
Okay. I'm sorry about that. I think it'd be best if maybe we got you an x-ray if that's okay with you. It sounds like maybe something more than just, a bruised ankle. I'll let your nurse know that your pain is at a level 8, and is there anything else I can get you before I go?
Sounds good, and no, I'm good. I just wish I could have some pain medicine. That's all.
I'm sorry, I can't give you anything as of right now, but before you know it, the doctor and the nurse will have everything figured out, and we'll see about some pain medicine.
Oh, okay, yeah, I assumed you would say something like that, but that's fine, thank you.
You're welcome. I'll see you when we bring you to your x-ray. Hi, I'm back. My name's Jasmine. If you forgot, I'll be your CNA still. Can I get your first and last name and date of birth, please?
Jaden Sinclair, and 10/08/2007.
Okay, sounds good. So, how did your x-ray go? Are you feeling okay?
Yeah, it was fine. The nurse had me move my ankle in weird ways, which made it hurt, but it must have done the job because the doctor said I got a sprained ankle.
Okay, great. You're already up to date with everything, which is great. The doctor did confirm it is just an intense sprain. There was no fractured bones or broken ones either, which is really good. That way you don't need any special surgeries or something more complicated, And did the doctor tell you what they prescribed for medicine?
No, actually, they gave me some ibuprofen, but the doctor said ibuprofen and Tylenol should help with the pain and any swelling.
Awesome. I just had to make sure you knew what the plan was for the pain reliever situation. Is that all sounding okay with you?
Yeah, that would be great.
Okay, I would like to explain some diagnosed treatment and possibly some rehabilitation if that's okay with you.
Yeah, that would be great.
Alrighty, so your sprained ankle is the ligaments inside your ankle, and they're torn and stretched farther than they should be, which was caused from rolling your foot. Some treatment methods you can try are rest, so avoid putting your whole body weight on your foot. Ice it for 15 to 20 minutes, compression, elevate it above the heart. Take some medicine as needed, the Tylenol, ibuprofen, ibuprofen. That'll all help reduce the swelling around the ankle and help control the pain. Does this all sound like some things you could do?
Yeah, I should be able to do all those things. Could I possibly get into physical therapy so I could have some help stretching and strengthening my ankle?
Yes, of course. I was actually just about to talk about that next and see what would work best for you. So first, we can start with some simple range of motion exercises like flexing the foot forward and backward, calf stretches, and tracing letters with your toes to improve the strength and mobility. All of those exercises can be done at home, and we recommend them to be done at least twice a day. You can do them at physical therapy if you'd like as well, and probably work them into your normal daily routine. About the physical therapy, it looks like physical therapy won't take super long, maybe 3 to 6 weeks, depending on how quickly your ankle recovers. Physical therapy will provide balance training, stability training, along with return to activity plan. Does this all sound like something that would work for you?
Yes, that would absolutely work for me. Thank you so much for figuring everything out and explaining that all to me. I feel like I actually understand what's going on for once.
That sounds great. I'm so glad myself and the nurses and the doctor were able to help you through this tough time. Are there any days in the week that would be open for you to schedule your physical therapy right away?
I could do every Tuesday and Thursday, anytime that works, or anytime works for me, and twice a week should work, but I can always let you guys know if something changes.
Yes, of course. Just let us know if you need to reschedule some appointments if needed. Whatever you need, we will try to provide, and I hope your ankle heals quickly. And I got this paperwork for you, just going over the diagnosis and the treatment and the rehabilitation plans. The receptionist would love to schedule your next appointment right away and probably set up your physical therapy appointments as well before you leave. If I can assist you, or if you'd like otherwise, I know the nurse said you were feeling a lot better already and tried walking. Would you want me to walk you out?
Sounds good to me, and thank you, and will do. I shouldn't need much help because my ankle's already feeling slightly less painful.
Okay, well, I'm here if you need me, and thank you for being an amazing patient. You are free to leave, and don't forget to schedule your next appointments.
Alrighty, sounds good. Thank you for everything. See you later.
Yep. Conclusion and reflection. It is important to communicate with the patient clearly and with compassion. The patient is the top priority, and taking in consideration the patient's morning routine helped the healthcare workers discover what caused his injury. Overall, throughout the entire process of preventative measures to diagnosis and treatment to possible rehabilitation, helped me learn the significance of being proactive and that the CNA's work is vital for improving the quality of life, helping patients ensure health, and lastly, encourage independence as much as possible. Observing hands-on care during my clinicals changed my perspective on the healthcare process. The experience, even though providing only small cares myself, made me realize the importance of each role. I now deeply understand the CNA's job and how much the patients depend on them daily. Thank you for watching.